Ready?
Yes, thank you guys for joining us. Just kind of running through what you may have missed if you just woke up. Well, first of all, congratulations on sleeping in. But dphss.guam.gov, that's the website. The governor, again, has repeatedly told everybody who is struggling, we're talking 15,000 workers, combination of layoffs, furloughs, hours reduction.
And that's just the numbers that we know of today.
Yeah, and so the governor is directing all this traffic over to the Department of Public Health and Social Services. And unfortunately, what we're hearing, and we really hope this is something that they rectify, and I know that Linda called me last night, they added some new lines, but people are saying the same thing. When you call Gov Guam, you didn't hold forever, they don't know, or they got to refer you to someone else. And it's so unfortunate. Right. It is, and the application process, it's not exactly quick and easy, but that's what we have right now.
I think, though, if you have gone through the process, if you were one of those 300 people that did get in, you did get to apply, give us a call and let us know what you went through and what you had to submit to public health. But because we'd like to share that information, and maybe whoever is wanting to apply, we can give them you could give them some advice. But for now, the only number that I have right now is just to call 311 and then the website, which is dphss.guam.gov.
And I put up in the comments on our Facebook live show, and maybe Ken can get that up there again, is there's actually a table of eligibility for SNAP benefits. And just to be clear, in speaking with Tess Archangel, there's no disaster SNAP assistance for people who haven't previously qualified. So you have to look at that chart and figure out your situation, and then I guess first of all find out if you qualify. And you got to get 311, and these caseworkers, they know everything you got to do, and sometimes they can wiggle it a little bit to get you in that program. So
there was also something that Rachel Ramirez, she joined us at the start of our program. She's with the Department of Public Health and Social Services ECHO team. She did tell us that the Division of Senior Citizens, they launched their contract with Health Service Pacific starting today. It's for Menumco 60 years and older that live alone, that don't have transportation. The Health Services Pacific will be providing those services. You need to call 735-3277, 735-3277, or 588-5274. So they will be helping out these Menumco that live alone, and their services are Monday through Friday from 8 to 5 p.m.
All right. I wanted to get the health chair on the line here because somebody had tweeted at me, what worries me, Chris, is no one is talking about ventilators. Please investigate. Do hospitals here have enough ventilators if we peak out with COVID-19? Are we prepared? Hospitals in the States are claiming not to have ventilators, so the federal government has been sending ventilators to them. Are hospitals here prepared? Do they have enough ventilators?
Well, the White House, the governor on Sunday, she announced that 30 ventilators will be arriving. I don't know if they're here yet, but that's the announcement that she made, that she had gotten a call or had gotten off a call with the White House, and that she was informed that 30 would be on their way. I'm assuming that we're probably going to need more than that.
Right, and so that's why I wanted to bring the health chair, Senator Therese Terlaje, because, ventilators, she's been talking about, you say no one's been talking about ventilators. You have been talking about ventilators for quite some time now, right, Senator?
Yes, Chris, thanks for calling. And I think because of, and I'm thanks for having Dr. Lombard on. I really appreciate the data that he puts out, and I follow him on Facebook. So I every day he updates that, and I appreciate that very much because I'm not a numbers person really. But it's been very clear from the start that if we're going to save lives with in this COVID pandemic, we need ventilators, because at the end of all the suffering that they go through, at the very end, the only thing we have left to help them is a ventilator, and some of them will be able to pull through after being put on a ventilator. Some not, but some yes. And so that's like our last hope. And with the calculations that Dr. Lombard, Dr. Cabrera have been doing, it's very clear that we are going to need much more capacity in ICU and ventilator capacity if we reach the numbers that they're predicting. So we've known from the start that we have too little ICU capacity on island at present, and we need to expand that. So everyone's been working hard on that goal: expand it and get more space, rooms at the hospital to fit these ventilators up at SNU also, and then actually get the ventilators to be put in. And so I was very glad, very, very glad to hear that the governor said we're going to get 30 from FEMA, because it's really been from the start. Everybody's supposed to be scrambling, where to find these. If you watch national news, you'll see this is like the number one thing that the New York governor reports, that the California governor reports. They're all keeping track of how many ventilators they have, because they know it's going to save lives. And they are, California governor, they talk about where they're getting these things. They're getting them from worldwide. They don't limit themselves to FEMA.
Right.
In fact, they compare how much they're getting from FEMA versus how much they're getting from every other source, every other company in their state, and any resource. They have, that's what I really admire, that they put down any barrier, and they've said, we're going to save our lives of the people of this state, and we're going to go all out and find these ventilators wherever they are. Do whatever they needed to do. So, yeah, anyway, so.
Have you been privy?
We've been trying, sorry.
Go ahead. I'm sorry. Go ahead.
I was trying to follow up on, do we have this? Do we have this? And it just seems so painstaking that it's slow. And I appreciate that there's a worldwide shortage, right? And so it's a very hard commodity to get. They're very expensive. And but I still think we need to increase our capacity for ventilators. The PPE, we still hear about shortages, that they're arriving, there's some on order, and test kits, same thing. These three very critical items, we need them now, and we need them to get through any kind of spike that we're predicted to experience. And so, I don't know, most recently when I've tried to follow up on where are these items, why do the nurses keep clamoring for PPEs, why don't they have them, why are they saying they're being rationed, all of that. But anyways, at least one person told me that the issue is this, under the current public health emergency law, the governor's authorized to transfer up to $100,000 a month, and up to $600,000. And so we're only, in I think the second month that they've been doing this, and so they've only been able to access $200,000.
And that's not enough.
Ventilators, it's not enough, right? Mm-hmm. So I just wanted to remove every barrier to save lives here, and these are the equipment that are going to save our healthcare professionals' lives and our people's lives. So I put in a bill that says, and I'm hoping that's a bill that we can address during session, that removes that barrier and allows a transfer up to $4 million. And I'll be honest, I pulled that number out of the air based on a number that they had put out earlier, but it's not proven. But I'm saying $4 million because for me there really should be no price tag if it's really going to save the lives, and bring these three items in at whatever cost they are. And I even put in this bill a provision that says you waive all the procurement restrictions because of how hard they are to obtain. And I don't want them to have to jump through all kinds of hoops. 3 vendors, forget it. You find one, get it, and bring it in. As long as we've got somebody up there who's certifying these are actually good quality equipment.
Right.
Then I say bring it in from whatever source you can find, and bring them in as fast as you can. It pains me to hear, we're waiting, and we're waiting, and I'm so afraid of any more deaths. I want to do better for the people that have them here. And if we have too many, then
that's a good problem.
We spend too much money. This is one time, I'm very conservative when it comes to spending money, but this is one time when I'm like, you go all out. Money should never, ever, ever be an option. I mean, or the impediment for getting these three particular pieces of equipment.
I like what you said there, Senator. Yeah, you are, fiscally conservative, and for you to be taking this so serious that you're willing to give the governor that kind of authority to go out and get these supplies that we need, I think it says a lot. I want to go back to the ventilators real quick, though. When we ask about ventilators, the response has kind of been to hold up these 30 ventilators that we're getting, but is it accurate to say that we were at such a deficit before that these 30 ventilators don't really bring, it is because that's what you're saying, but they don't really bring us anywhere close to where we need to be?
they bring us a lot right now for current capacity, a lot. Trust me, that's huge. That's more than what we have on current. We only have island-wide, I think, about 20-some. So that would double our capacity immediately if they actually get here. When it comes to these things, I don't count on it anymore because I've heard so many promises and I want to just see it actually here. So I keep calling them every day. Is it here yet? Do you actually have it? But yeah, that would double the island's capacity.
Yeah. I was just saying, I just find it surprising that the governor doesn't have the authority to use whatever resources that she can just go out and do what she wants during a state of emergency, because the executive order, I mean, it's clear when you read it that it says suspension of statutes, orders, rules, and regulations that prevent, hinder, or delay necessary action to respond to the emergency. And that's when she declared the state of emergency.
Right, that's correct. Regulatory statutes she's able to waive by executive order. The issue is, I mean, sure, I think they should have money because, under the regular budget, they've got about, the last time Ed Byrne was down in the legislature, he told us that the 2020 budget, there's about $80 million of regular transfer authority there. So you transfer, to public health or GMH, for example, to purchase. I don't know. For me, that should be able to happen.
Yeah.
But like I said, I don't want any impediment or any excuse of why we're not able to get these things.
Okay.
And but the public health statute that you're talking about, Sabrina, it does limit spending to $100,000 a month.
Right.
And just because we know ventilators cost
more than
so much, $30,000 on estimate. So yeah, it's just these are high, and the PPE, we're buying them in huge bulk, so it's expensive.
Yeah. As we should.
Or that's what we want them to do, to buy
Right.
them in bulk, so we're not like begging every day for more PPE. Yeah.
Right, Senator. I wanted to. Are you kind of? Can we move over to? Because I wanted to ask you about tax refunds.
Oh, sure. If I could just finish one.
Yeah, go ahead.
On the ventilator. 30 is a lot more. It doubles Guam's capacity, but it's not enough when you look at the estimates by Dr. Lombard and Cabrera. So still not enough. That's why I'm saying we still need to get up to that capacity. Better, safe than sorry. We need to plan for the worst and just have those available.
Right, and that's why I think when we ask these questions about how many ventilators do we have, the response is that we got 30 for DSO. So I'm glad that this is something that because I had somebody who was like, hey, no one's talking about it, and I thought of you, and I'm like, okay,
I wrote them a letter. I wrote the governor a letter just suggesting that, for me, I would feel very much more comfortable if in our press releases, press conferences every day, that they report on every effort to get ventilator, and concrete, like, we were able to secure 5. Those will arrive on this date. That's what I really would like to hear.
Yeah, I saw that letter.
Then I think that our health professionals are going to feel like we've really got their back. We're really going to give them the tools, and they can say, and then we can tie it to why you're staying at home. You're staying at home because we are trying to save lives, and we are waiting for ventilators, right? We're waiting to get some of this equipment in to save more lives, and that's why every person staying at home is so crucial. It's critical because we're buying ourselves time, hopefully, right? That's one of the reasons we're making everyone stay at home.
Right.
But
can I ask you about tax refunds now?
Sure.
So this is something I'm just because I keep getting a lot of calls from friends, family. We're seeing it in the comments, and I know you've been pushing for the early release of processed tax refunds. I just wanted to kind of get a clear picture from you, because I know you're in constant communication with Daphne over at Rev Tax. People who get the EITC, some of our, working poor, a lot of them file in January, right? And so now I'm getting the calls about people who wondering how far, how current, up to what filing date are we up to with the processing of tax refunds? What can you tell us about that?
Well, just yesterday there was an announcement that they paid out 248 more tax refunds, and so that was from November filings, right? So from my calculations, so we received a formal report from the Department of Revenue Tax and DOA that as of February 2020, there were 4,398 processed but unpaid tax refunds, right? Tax returns. So I tried to, it makes sense, right? That if we've got unpaid tax returns, that should be our number one priority right now. This is money borrowed from these people, right? Borrowed, but they overpaid. So it's not our money. We owe them. And of course, the government has given itself 6 months on regular time to pay these back, but I think these are not regular times. It's unconscionable at this point to keep this money any longer than we have to. And so I'm trying to follow up why, we're not paying all of it. If we've got 4,000, that's a lot of people, 4,000 unpaid refunds. So
Right.
I've calculated all their payments that they've made, for the month of March and April. And, I might not be perfect, but I still calculate that there's still 3,000 people, 3,000 returns that are unpaid and processed. And already processed. This is the big thing. They're processed. So all we need to pay this is to cut the check. It's
Right.
that. And it's the process is in place. I think it takes minimal manpower. It's not like we're going to have to call the whole departments back in.
Right.
But you're just going to cut these checks out. They're going to get them. And these are the people I'm thinking that when they get this cash, this is what they need. This is what they want in order to get the food and in order to protect themselves,
Right,
get the safety
right.
equipment that they need just for their families.
Yeah, and that's something
And
I wish that it would run parallel with what the governor's saying about go apply for food stamps. I just wish there was more of an effort to get you're right, 6 months, and that's what we asked Daphne, and I know Ed Byrne has said the same thing. They hold up that, we're complying with the court order, but I totally agree with you. This is not, a 6 months regular time. They need it yesterday. They need it last week, 2 weeks ago.
Yeah, I'm telling you, Daphne, I love her as a director. I think if she's there longer, we're going to see a very, very efficient revenue and taxation.
Do we have the money, though, Senator? Because, I wonder if we
Well-
ask about this, are they going to say, we don't have the money? Do we have the money to pay those 3,000 tax refunds today?
Well, in Ed Burns' latest letter to me, he said we are planning for, this in our cash planning. So, planning to pay them, in time for the 6 months deadline. So they're planning, but I'm asking them to change those plans. I just feel like, people we want to give, they want their money from, the IRS. That's $1,200. We're waiting for that to come in. This is something that can be done today. I swear, today.
Today?
It can be done. Yes, and
Right.
it's just a matter of maybe prioritizing some of the expenses. I don't know what this amount would be, and I know they've been trying, but I just think
Try harder.
we have to reprioritize. Right. This really should be done before anything else. Before we give out any more money,
Right.
why not give the money that it's their money?
Do you have any idea tomorrow what's going to be on the session agenda, and if finances are going to be discussed? Do you guys plan on bringing in, going into the committee of the whole and bringing in Ed Byrne, bringing in Lister Carlson, bringing in Daphne to figure out where we are financially and how fast we can get out whatever local assistance is needed?
I don't know. It's hard for me to predict what exactly is going to happen during the session, but I know that everybody, just from the feeling I get from different people, that they want to be in there as limited time as possible.
So there's no Democratic, there's been no caucus with the Democrats to discuss.
Yeah, we've
we're
been
gonna talk.
caucusing, but I don't think anything's set in stone yet. So but
Is that different, Senator? If there was an emergency session in regular time, would you guys already know what was on the agenda?
No, not always. It just depends.
But there's a rule here that says you got to submit your.
We set our agenda in a rules meeting. So these are being called, without rules meetings. So that's why it's very hard to predict. And
Right.
I don't ever want to predict something like that because
Right.
things change all the time.
But when we see
but what I'm saying is, of course, it's very clear the speakers, responding to the governor's call for those
Bills.
increase restrictions. So I, suspect that's one of the things. And for me, I want this bill that makes sure that they can get that equipment that they need. I'm going to try to amend it if I can to make sure that some of the things that have been talked about and promised that they're also taken care of, because I don't know what's the holdup with these, where they talk about nurses are going to be able to have a place to stay so that they don't have to go to their homes. Those who are COVID exposed, right? That they don't have to go to their homes and expose their families to the virus, that they will have a place to stay. So they put this in place for sure for SNU staff. It's not clear whether it's all in place for everyone that needs it at Guam Memorial Hospital.
Well, Lillian Posada said yesterday during the press conference that it's offered up to all the nurses, but some of them said no because they want to go home to their families.
Yeah.
Correct. No, there's a gap that I think some of them haven't even, they
weren't
haven't
aware.
heard the offer.
Right,
So yeah, we
right,
have to
yeah.
just make sure that those gaps are closed, and I'm sure Lillian's going to do that. But also, even these homeless exposed, we need to move faster on that. And
Yeah.
I see the other states how they do this. And
We've been
Man.
talking about that.
California's rolled out an entire program. They've taken over motels and put the homeless in there because the debate they're having is, of course you can't put them into a gym and put them all in to be congregating. That's not, of course, that's not going to work. So
Yeah.
we need to find other housing. And I just think we can do this, but we have to.
We keep asking about it, Senator. We've been asking about the plan. We heard, I think it was last week, could have been the week before. I'm losing track of time. But we had asked about what are the plans. We heard something about a tent city.
Yeah. And then yesterday, the governor was mentioning about how some of them don't, they can't force the homeless people to go in. And so, there's a majority that are in Agana, but it wouldn't be just in Agana. It would have to be in all these other places. But you'd have to have a shower. You'd have to have porta potties.
Yeah. But I mean, I know that I know it's something they want to do. We just don't know why they're not doing it.
Yeah, but anyway, so back to session. I'm hoping this bill gets on. I'm hoping that they pay the tax refunds before we go into session, because I'm telling you, if we're going to go into session, talk about unemployment insurance and whatever else. Of course, we want to get those who are suffering as much help as possible.
Right.
But this is just I feel like this is one of those that doesn't need any more mechanisms to be put in place, and that's why it makes so much sense.
And it does.
Otherwise, and I'm trying to push, I also wrote a letter to Reverend Tax and asked them, for this federal aid that they're going to receive, why don't they just, prepare that list right now? They have all the tax return information. They should know, according to, the IRS amounts, who's eligible, and just make that list right now. Have it ready to cut checks. If they allow us to be the ones to cut the checks, have that ready so that we can cut the checks the day after they drop that money in. And no delay as to... And I feel like if they prepare a list right now, it's kind of like that tax, the real property tax
Right,
rules,
right, yeah.
that if they prepare that list and they have names and amounts, then everybody can either call up and say, those who are really worried, like, they can call in and say, am I on there?
Right.
And then they can correct the errors now. Yeah. In this time that we are waiting for the feds to do their part, we just we correct the errors. So we have an error-free list, and we cut checks the day one. We don't wait for whatever other days to get that information. I heard this talk about, the bank saying, they didn't like St. Nicholas's proposal because, people would have to come in and make applications. But I'm hoping, man, that Revenue Tax can come up with a way to just avoid that. I feel like they have all that information already. And why should people have to come in and apply? They've already filed their tax returns, and if they're eligible based on tax returns, then they're eligible. And let's just make that list. And then there are some who haven't filed because they weren't required to file, right?
Right.
And those are the people I feel like we really need to help. I want to help them right now to, Daphne says they need to file now, even though they are exempt from filing. They need to file in order to get this. And those are the people I'm hoping we can spend a little bit more time on, in this interim period that we spend a little bit more time just making our list perfect and giving them that assurance instead of, telling them, well, if you're like this and if you're like this, you're going to qualify. I would rather just prepare the list and tell them, yes, according to our list, you're qualified. You're qualified for this much and you're qualified for this much. I hope they can do that. That's something that they can do right away, I'm hoping.
I appreciate your time, Senator. I just want to go back to what you said about paying out processed tax refunds today, right now. If the governor is saying that, she doesn't want any bills to be introduced that tap into local funds,
yes,
then I agree. I think that if this is something we can do, we should just pay out these tax refunds, get that money out there to people that it's owed to. These are people that could use the cash, and they can't all go apply for food stamps because it's going to take a while. So, right. I think the governor's got to put the money where her mouth is and say, hey, if you guys aren't going to spend, if I don't want you to spend local money on local aid, then I'm going to pay out these tax refunds so that we kind of fill that need, because there's a huge need out here.
at least some, that together with the SNAP program and
Right, yeah.
Medicaid benefits over there on that side, hopefully these together are a little bit, a little bit.
Right.
There are also 2,370 unprocessed refunds at the end of February. And this is something I've also asked Daphne. If you're going to bring employees in and you can bring them in safely, can they process refunds, right? I mean, it's always supposed to be our priority is to get these refunds processed. And I'm
sure they want to too, Senator. I'm sure there's revenue tax people that want to come in and they're hearing the cries of the people. Thank you. We got to run.
All right. Thank you.
Okay.
Thanks.
Take care.
Yeah.
Sabrina, thanks.
Good
Bye-bye.
luck.
All right. Senator Therese Terlaje, of course, Legislative Health Chair 926. Yeah,
That was a lot of information.
it was a lot of information. There's a lot of stuff going out. Hey, I want to throw out the website again. The food stamp comments. What we've been told is you call 311. They've stood up a special line. It's like a directory style thing where you press this, press that, and you jump through the hoop, do a backstand, whatever.
Just press whatever the number is that they tell you. I might have it somewhere. But I do want to just add to what you guys are talking about, Department of Revenue and Tax. They're mailing out 248 tax refund checks this week.
Right, yeah.
For $861,200.
And
this is for on or before November 2nd.
Right, and so that's kind of what they've been saying. We're not saying that they're not paying the tax refunds because there is a court order that they have to pay it 6 months from a filing. We're just saying that that's okay on any given Tuesday, right? And a regular time. This ain't a regular time.
So
Extraordinary times call for extraordinary actions. And that's what we're waiting to see from our government.
And extraordinary people to stand up.
There you go. And I just want to commend all the people who are stepping up out here. I keep thinking about this, and it's a lot to process, but people in all walks of life, all, professions from, doctors, nurses, on down to, guys who pick up you guys' trash, people who drive the mass transit buses, people who are cooking your meals while you're at work. There's just so many people, because we're seeing non-essential people stay home and businesses close. Everyone else who's, out here, boots on the ground, on the ball field, everybody's stepping up. And I just want to thank you guys. And you just know, like, you guys are in my thoughts, man. I'm praying for you guys every morning. This morning I had to pray for DOC. This is we talked with the Major Anton Uggan, and they're concerned. They're really concerned about the exposure that this cadet who tested positive, may have brought into the facility. And, they're doing what they can. And it's just, it's a lot to handle for those inmates and detainees or the corrections officers, man.
Yeah. And I know someone personally who's had contact with the person that tested positive. So I'm concerned about him and I'm concerned about his family. They do have children. And so,
right.
I hope that everything works out for them.
Yeah, stay home, guys. Stay home. If you're staying home, if you're feeling the symptoms, you call the doctor. But again, that's why we have to stay home, because the government of Guam and Magahaga are telling us to assume that we all have COVID-19. Okay, and that's why it's important to stay home, because if we all have it and we're all going around hee ha ha gallivanting, we're spreading it. And so again, that's why we have the power to kill the curve. Democrat, Republican, independent, no matter what, no matter what you want to do in the bedroom or anything, no matter what, all walks of life, we have the power.
Right.